Yeah, so I was at work. I had totally even forgot that you were doing the draw that day, and I was at work, and of course I felt like I was winning, entering a lottery. So I had gotten a whole bunch of DMs on my Instagram, and I questioned someone what's going on, and they said go watch Spectrum Aesthetics live video of their draw. And then my stomach sank because I thought, so then when I went and I saw that I was the winner, I couldn't believe it. I was with my friend at work and I was shaking and I was crying, and I said to her, can you please rewatch that and tell me if that's what I just saw? And she started shaking and crying, and it was honestly like one of the happiest days of my life. So my name's Amanda, and on Instagram I'm AmandaJean_RNY. I've got 3 kids, and I'm a single mom of 3 kids.
Nice.
Yeah.
Where are you coming from?
I come from Toronto, Canada.
Is it cold right now?
No, it's nice, and it's cold here in Miami.
Cold, it's just rainy, sucky weather. I'm so sorry.
Yeah.
What type of procedure are you having?
I'm having a tummy tuck.
With
Dr. Ortega.
Dr. Ortega, perfect. Yeah. And how did you hear about Spectrum Aesthetics?
At the beginning of my journey, when I first got onto Instagram, I started following Aubrey, that's what she eats, and I saw her whole journey with you guys. So I followed her through there, so I've been following you guys since then.
What are your expectations?
I have realistic expectations. I know I'm not going to be a bikini model. I know that I've done the damage to my body, but I just expect to, I love myself already the way I am. I just want to enhance that.
Okay. Do you have any medical problems?
So Amanda, tell me about you a little bit. How old are you?
So I'm 36 years old.
Okay. How much weight have you lost?
165 pounds.
165. And how did you do that?
I did gastric bypass.
Okay. What year?
2017, January 30th, 2017.
Okay. So it's been like a year, almost a year and a half.
Yeah.
All right. And that, when did you lose the most of the weight?
Most of the weight, the back end of 2017, probably.
Okay, so since then it's just been slowly and smaller, which is probably a smarter thing anyhow.
Yeah.
Okay, and so in the course of this, I know you feel better. Whatever health issues you were having, they either disappeared or got better.
Yeah.
What was the worst thing that you were having?
So I didn't actually, I didn't have any major health issues. Thankfully, I got to do this prior to ever getting diabetes or heart trouble or anything like that. It was more mobility. Mm-hmm. Yeah, I have 3 small kids, so trying to run around after 3 small kids was impossible.
Tying your shoes.
So, putting on socks, like the story I told earlier. Yes.
Puffing and puffing, putting socks on.
Really tough.
Yeah, right. And
a lot of pain.
And you wonder why you have to do it at such a young age.
Yes.
Right. So needless to say, you're much relieved to not have all those symptoms. You have beautiful eyes, by the way.
Thank you.
And nice teeth.
I'm a dental hygienist.
Oh, you better. Yeah, you better. It's like my sisters. I have 2
Bad
sisters.
for business if they're not.
I have 2 sisters that are hygienists, and it's like, I said, so girls, when you're looking at a guy, what's the first thing you? Oh, wait, you always look at their teeth. I said, I don't believe you for a second. She says, no, but it's the second thing at least.
Yeah.
Okay. So how would you say what is it about the sequela from your weight loss bothers you the most?
My loose skin.
Oh, well, it's always loose skin,
yes.
but where in particular?
My stomach.
Your stomach.
Yeah.
And I know it kind of goes
right around.
All the way.
Yeah.
And then you lose some of that because it heads south.
Yeah.
Right. So what do you hope to accomplish with this operation? Besides obviously feeling better and fitting better.
Yeah. So the feeling better and fitting better, and I just want to feel, because I'm more mobile now, I just want to feel good in clothes. I know I'm not going to look perfect in that, but I want to be able to shop and buy clothes that fit the body underneath the skin.
Mm-hmm. Correct.
Yeah.
All right.
Yeah.
Go back to where you had been at one point in your life, right?
Yeah. Yeah.
Okay. At some point in your life, you
teens.
were. Yeah, it's
That was my teens.
You see some people, and then me too. I was a skinny rail, and then I got too heavy. I ended up doing something myself as well, because I just got to the point where I couldn't do it, and I know I like to eat, so now I just eat small amounts.
That's right.
All right. So just in summary, this operation has a very high degree of satisfaction because it dramatically transforms a person we're going to do something towards on the back end that will help restore the le derrière, as they would say in French. Okay, and in a woman that's important, because in men they wouldn't probably care.
Right.
But for a woman, if you do anything to lift in the back, but you lose your shape, no matter how well lifted it is, you're going to have you'll lament a little bit. So with reconstructive techniques, which is part of the whole training in plastic surgery, is more reconstructive than anything else. Even though we're applying it to quote unquote aesthetics,
Right.
It entails the knowledge of how to do that with preservation of tissues.
Right.
And in the case of a lower body lift, what we do in the back is that we mark the skin in such a way that we take out the overlying skin, but we preserve all the underlying tissues, and with the idea of then taking that tissue and sort of burying it underneath the skin that we're going to pull up over it. And not only does it restore volume and shape to you, it even contributes to the lifting effect, because now you have to go over something that's filling it there, and it gets more of a tightness that you wouldn't otherwise get if you just pulled it straight up and didn't have anything in there.
Right.
Okay? All right. So
I'm excited.
any questions you have for me?
No, I think everything's been covered.
Talked
Yeah.
about all your precautions
All
and
of
the medications, the injections, all that stuff,
Yep.
right?
Yep.
Okay, good.
Tomorrow's the day.
Tomorrow's the day.
Oh, props.
It's okay, we can do the props there like that. Okay, just don't break the hands, that's all.
Oh,
Okay.
I know.
I know. I didn't
I'm a
think
dental
you would.
hygienist. I'm strong.
Right, we both need our hands right. Okay.
Yeah. I am now 3 weeks post-op from my tummy tuck. Life has changed so much. I am more confident outside. I notice that I'm trying things that I never would. My recovery has been so easy. I've been so blessed. Helping Hands Recovery House was amazing. They helped me to recover well, and yeah, I recovered so well, and I had not a lot of pain. I think I took painkillers the first day, and that's it. And yeah, my drains came out really easily, healed up really well. I bled a little bit out of my right hip, but apparently that's a common thing, a little bit longer than most people might. But yeah, it's been great. It's been non-eventful. It's been life-changing, absolutely life-changing. And I owe so much thanks and gratitude and appreciation to Dr. Ortega and Spectrum Aesthetics, because without them, I would still be living with that belly. This summer, I got to enjoy summer with my children. Not that I didn't enjoy it. Of course, I always enjoyed it with them, but I get to live life. I get to go swimming. I get to run around, ride bikes, all those things that I would stop myself from doing in the past because of my belly, because I'd be scared while I was riding the bikes that, you know, my legs would be hitting my belly or people might see me and judge. And while I embrace that, you still live with it daily. So it's okay to embrace it. Like, I embraced my stomach, and I felt like it was a badge of honor near the end, and I absolutely felt that. I was very proud of how far I had come, and I know that if I hadn't come as far, my belly wouldn't be the way it was. So I did embrace it. But in the same token, you know that society is judgmental, so you don't feel fully okay with it. So I'm sitting in this because this right here is the first swimsuit that I have bought since my tummy tuck. I bought it today, and I am going to the beach this weekend with the kids. So I am going to show you what the bathing suit looks like, and then that will be it. So here we go. This is the bathing suit. This is the first one that I have bought post tummy tuck. It's near the end of the day, so I can feel a lot of swelling right here. But I get to wear this. I get to go on the beach and I get to feel proud. My belly used to hang way halfway down my legs, and it's all gone and it's flat and it's a little bit, I'm going to take the sexy at baby steps. So for now, this is perfect for me because the way it's showing just a little bit, and it perfectly covers my incision line. So I don't have to worry about that being exposed to the sun. And yeah, so I get to wear this with my babies, playing on the beach, feeling confident, feeling happy, loving my body. And I'm just so grateful. Life is so good. So thank you so much to Spectrum Aesthetics, Dr. Ortega. I am forever, forever, forever in your debt and forever grateful.